Greetings to you all. This is Living a Full Life Forum, a forum whose vision is a society of men, women, and families who have healthy souls and emotional stability, who are living fulfilled lives and reaching their highest potential in life. That is what we aspire for at Living a Full Life Forum. I am your host, Dr. Violet Kayom. It is such a beautiful morning right here after a heavy downpour, and the whole place is green and fresh with a cool breeze, and so we are enjoying it this side. I hope you're enjoying it too. Please, let's make the best of life. We have one life to lead, and so may we make the best of it. It is very exciting for us at Living a Full Life Forum today because we are launching out into the online world. This is actually our first episode to launch out, in the online world. We have been around for some time, mainly holding physical sessions, counseling sessions, mentorship sessions, and conferences. But the time came when we realized that the benefits were so immense, we needed to share with everyone. And so we are so excited to join you, and we are happy that you have joined. And so we welcome you and we ask you to subscribe. Please do subscribe to this channel and you will never regret it. I know in the next few minutes you will know exactly why. I'm so confident that you will never regret it. Okay, so today being our first episode, our inception episode in the online world, I'm going to take quite some time, to tell you about living a full life. You see, every journey is enjoyable when you know how the journey began and where it is headed. So that is when you can enjoy working with someone. And that is exactly what I'm going to share today. So I'll give a brief intro about us, how we started, and what we are headed for, and why you must be part of this. And so just stay tuned and pull that chair close, get that cup of coffee or tea or whatever it is, and let us go into the deep of the matter. So, first things first, I know some may not know me, and so I'm going to introduce myself briefly. I'm called Dr. Violet Kayom. By training, I am a medical doctor, specifically, specializing in pediatrics. So I'm a pediatrician and a child health expert. I have a lot of passion for psychosocial health, and so I do a lot of psychotherapy and especially family therapy. I also have other things I do. I am a public speaker. I do write books. I'm an author. I've written quite a number of songs. So along the way, you may listen to some of the songs. And then I'm a life coach. And so it is a blessing for me to be your host. Now let us go to Living a Full Life Forum. How did we begin? I'm going to give you a few highlights on the background of Living a Full Life Forum as regards my professional, a journey and my life experiences. So I taught in the university for 15 years. I was teaching in the Department of Pediatrics and Child Health at Makerere University. And within that time, I had a lot of students I was mentoring. As part of the faculty work, you're expected to mentor students. You see, medical training is very intense and it can be intimidating. So it helps a lot if you have someone older walking the journey with you, holding your hands. So I had these students allocated to me, and we had sessions with them, and along the way there were many others who also joined, somehow maybe because they thought our mentorship group was benefiting a lot. Yes, so as I scanned through the issues we were discussing and I made some survey, I realized that actually most of the issues that we're discussing were totally out of the academic line. So you see, the curriculum, is so academically focused, desiring to train this medical personnel into, a very excellent, professional. However, the needs of the students seem to be a bit different. So most of the things I was dealing with were family issues. For instance, someone would be worried that, their family is dysfunctional, or maybe their parents are going to separate. There were other issues of relationships, financial issues. There were only few cases that would come, really seeking academic, mentorship. And that was very strange. And so I realized that much as we are geared on training this professional, and maybe every time I'm lecturing, I'm really teaching these subjects, maybe half of the students have their minds really totally away, thinking about something totally different. And so I realized the gap, in some of these psychosocial needs of the students. And so I started having more sessions to the point that sometimes even in lecture rooms, when the lecture is supposed to be 2 hours, I would apportion some 15 minutes and we call it a session for life's issues. And so I'll allow the students to ask questions about life, or we'll discuss, topics of interest. They will bring up topics about relationships. How do I know who is the right person? How do I deal with anger? How do I deal with rejection? My family is falling apart. What should I do? And so that is how, I went on and spread on into other colleges. And there was this specific incident that, really sticks to my heart, so dearly. A young man in his 3rd or 4th year of training came to me and told me, "You know what, doctor, I do not know what to do because I think I'm going to commit suicide." And I said, "Why?" It's like I'm having these thoughts and voices speaking to me. And I asked him what had happened. And of course, I realized that 2 to 3 weeks before, there was a student in his hall of residence who had fallen off the top floor, of the hall of residence and actually died. And so it traumatized him very much. And now he was wounded and he was having these, thoughts. So I counseled him, had some time talking to him and told him, some coping skills and prayed with him. So when he went, a few days later, we met again and he was like, "Oh, I'm totally fine. The thoughts are gone, I'm back to books and everything is okay." And that was really exciting to me. And so I had many of those cases. And of course, my office had always a box of tissue because there were enough tears, from the students, which was really good. Over time, I moved on into more of private practice and I realized similar issues with families. There seemed to be a category of parents bringing children or patients with recurrent illnesses. And there was a pattern that many of those, when I probed further, they always had psychosocial issues underlying. And whenever we had more extensive sessions of family therapy, then the hospital visits would reduce. And so it launched me further out of the confines of the university walls into, my clients out there, my patients and families. And so when it became overwhelming, I decided to start having, conferences and group sessions so that, many people would benefit at the same time. And so I thank God so much for that journey up to this point. Okay, so now I'm going to the next part of the presentation. What are we up to now at Living a Full Life Forum? So like I stated in the vision, our emphasis is around the soul, a healthy soul. Okay, and emotional stability. A healthy soul and emotional stability. You see, the soul is one part of our body that is extremely important. And for you to just remember, as a human being, we have 3 parts. We have the physical, that which we see. Then we have what we call the soul. The soul is that part of you that consists of your mind, your thoughts, okay, your emotions, and your will, okay? So that is the soul. Then, of course, you have the spirit part. Now, every part of this has to be healthy for the whole human being to be healthy. And it seems like the soul seems to be the pinnacle. It seems to be this intersection between the body and the spirit. So the state of the soul will really determine how the body functions. So there are many diseases that have been found to actually originate from the soul. And so if we do not have an idea of what is happening in the soul, we may continue treating diseases that are manifesting in the physical and yet not really reaching the root cause if we don't pay attention to the soul of a human being. And the WHO, the World Health Organization, rightly defines health. That health is the state of physical, mental, and social well-being, and not just the absence of disease or infirmity. So it puts into account that the mental aspect, the psychological aspect, the mind is very important. Now, why do we aspire for the soul, the health of the soul at Living a Full Life Forum? You see, most hospital settings, the way we clinicians operate in hospitals, and then the way life is generally, we tend to care more about the physical. And that is why you dress up nice, you put on, nice makeup and nice hair, you do your nails, and you spray perfume. We are taking care of the physical part of the body. Okay, and then when you have a headache or you have stomach pain, you get a painkiller or you quickly go to hospital and get care. So all that, we are taking care of the physical because it is obvious. However, when it comes to sorrow or pain in the soul, it's a bit difficult, to put your finger to it because it is deep inside there. And so sometimes there may be manifestations in the physical, and then you end up treating what is physical, and yet the origin is actually the soul. And so we feel it is a part of us that has been neglected to some degree. There is a gap in management. We run so much to take care of the physical, and yet the soul may be the source of all the problems we are experiencing in the physical. And there are not too many forums or places where there will be time to take care of of things to do with the soul. In the hospital setups, yes, when someone comes with a headache, I'll take a history, and do the examination and, prescribe the treatment. Treating the headache, from the cause I've got, as I take the history. However, there is not much time, allocated to probing further. And the way our hospitals are set up with our large patient numbers, you as a clinician, you may not even have that much time, to probe. Yes, we do have the mental health aspect of medical practice, and I honor the psychiatrists, I honor the psychologists, we work closely. But you see, by the time a problem is reaching the door of the mental health practitioner, it is like the break point. So much has been going on that now the person has broken down into depression, anxiety, or schizophrenia, and all these mental illnesses. And yet there was so much time that was lost in between there. So at Living a Full Life Forum, our role is to come in, to help our clients, to help, the population to have ways of, identifying the root causes at soul level and, the treatment that they can receive so that we don't reach that breakdown point. And so we can also avoid some of these physical manifestations of illnesses that are coming from the wounds in the soul. So I hope you get the point why we are here. Yes, so in the next few minutes, I'm going to tackle just some two key things that I think are very important, especially for this inception presentation. Okay, the first is, what are some of the root causes, of these soul wounds, of these emotional wounds? It's important for us to know that. Then the second part I'll look at is that, what are some of the physical manifestation of illnesses that actually come from the soul? Okay, so with that, you'll be able to kind of like identify in your life or in someone close to you what they could be battling with that may go beyond just the, the medical treatment that they are receiving, to the point of, maybe the desire to have more of the soul attended to. Okay, so emotional wounds usually occur, following traumatic experiences. Okay, that is the most common, like a major trauma, when there's a major disaster that happens, something that is so scary, that something that, would threaten the life of an individual. So that creates a wound, in the emotions, in the soul of a human being. So it may be like a natural disaster, like an earthquake where someone saw people die, or it may be like, flooding, or a war situation, or famine where there is risk of life. So now that one ends up getting embedded in the soul of the person who has experienced it. Then there are other issues that occur in families. There may be dysfunctional families where there's a lot of violence, there's a lot of psychological trauma, there's a lack of validation and all that. So all those get embedded in the soul, and they act as wounds because there's like a dent in the soul of this human being. Then there's some childhood experiences, for instance, defilement, or some other violence that a child experienced. So all those ones, they traumatize the person, and then they get embedded in the soul of this person. There are other issues of abandonment, of rejection. In schools, children may undergo, bullying. At workplaces, they may be bullying or experiencing a shameful experience, a shameful a situation, or being reproached, amidst your peers. So all these form wounds, are in our souls. So what happens? In the short run, the body tries, the human being tries to cope, and there are different coping mechanisms. There's a category that will cope by, just sinking low and giving up altogether and withdrawing completely. But there's another one that will, fight it out and become so aggressive and put on this opposition and violent behavior. So all those extremes of coping may not be the most healthy. Okay, so with time, usually to reduce that pain that has been experienced, what the body does is now to start pushing these painful experiences into what we call the subconscious. You see, the mind has two parts. It has the conscious part, it has the subconscious. So some things that are very painful, they are pushed further. Okay, so they are hidden there to prevent the pain from occurring over and over again. So in the short run, that is helpful because it prevents you from having the pain at that point. However, in the long run, it is not helpful at all. It may actually be detrimental because these wounds are there. As long as they're not attended to, they remain there. So it becomes like, a wound or an infection under the skin. When there's an infection under the skin, so you find that the skin may look nice, but below there, when there's bacterial activity going on, then it forms this swelling, which we call an abscess or a boil. So the skin may look nice and shiny. However, deep inside, there's a lot of filth and debris going on. So when you apply pressure to this swelling, then the pain comes. So you find when someone doesn't have emotional healing, doesn't have healing of the soul, any pressure of life will make them very agitated. So someone ends up, reliving that experience over and over again. So when they come across a person or situation that looks like what hurt them, then they react out of proportion. So you find someone, shouting and reacting so much and saying words that they live to regret. Now that is not a good state. That is not a healthy soul. And now because of all this, now what happens? That takes me to the next part, why we get these physical manifestations of illnesses, okay? So when the body is tensed up with all these emotional wounds, with all these soul wounds which are not attended to, then it affects the rest of the body. It affects the nervous system. It affects the nervous system, and that is why when you are stressed, sometimes you get headache. Okay, the nerves become tensed up. It also affects other parts of the body like the immune system. So you find that the white blood cells and other factors that are responsible for fighting disease are not produced enough. So you end up easily catching colds and these other infections because your immune system has gone low. Thirdly, it affects what we call the endocrine part of your system. Now the endocrine is what produces hormones and some chemicals which keep our bodies in balance. It keeps our bodies in check. But the moment there's too much trauma, there's too much unattended trauma, the endocrine system will not function as well. So then it leads to a number of diseases which manifest in the physical. Okay, so now we are going to look at some of these diseases. The first, high blood pressure and heart disease. So you see, when there's a lot of trauma, it releases what we call stress hormones in the body. Now, these stress hormones, what they do, they end up causing narrowing. They constrict the blood vessels, okay? And then they also make the heart pump a bit faster than it should. That raises the blood pressure. If it is chronic, if the wounding is there for a long time, not attended to, then what happens is the body ends up being in that state where the blood vessels are constricted and someone ends up developing high blood pressure and other heart conditions. Number two, we have diabetes. Diabetes is a state where the body sugar is not well regulated. These same stress hormones will affect, how, the body sugar is regulated, how the organ, the pancreas functions. So you find that someone ends up developing diabetes, or when they already have it, then the blood sugars are not well controlled. Other things, of course, with all these psychological wounds, people respond differently in terms of nutrition. Other people overeat, others undereat. Either side, it is very dangerous, because malnutrition from undereating, will result into low immunity and other issues. Then overeating will result into obesity, and then high blood pressure and other complications. Then, of course, there are other bone problems, arthritis, bone and muscle problems that may occur as a result of this, chronic trauma that is not attended to. There are other things like sleep abnormalities. When you are stressed, when you have these psychological wounds, it may cause what we call insomnia, lack of sleep, or breathing difficulties during sleep, what we call sleep apnea, and these are very dangerous to our bodies. Then, of course, people have different coping ways. You find that some people may end up using drugs. For instance, someone may have these low moods and resort to cigarettes. Now you see depression or low moods, it has been found that they usually have low levels of dopamine. Dopamine is a very good chemical in our bodies that help us to feel nice. It makes you to feel, up there. So when it is in low amounts, then the body becomes depressed. Okay, so you feel this depression. So cigarettes, which has nicotine, helps to kind of like produce more dopamine. The only problem is it is short-lived. So within a short time, the dopamine will be gone, and then you will desire to take more cigarettes. Now, the more you take the cigarettes, then you are being, you're subjecting your body to high blood pressure and lung cancer and all these issues. And so there are many, diseases that originate from psychosocial, traumas which are not attended to. And so sometimes when we are treating these things, we have to be mindful that there are also soul wounds that have to be attended to. Some cancers have actually been attributed to prolonged stress, because the stress hormones end up dysregulating the body and leading to production of cells, in increased amounts, and then cancer ends up developing. Yes, so those are the key physical manifestations. Of course, there are social ones. You find that someone, who has trauma, they may not have, relationships that are stable. They may be withdrawn. They may develop, the coping mechanism of using, drugs and all that. That may be detrimental to their families. Other people end up channeling all their anger into aggression, verbal and physical, and all these cause breakdowns. So studies have shown that actually the most common cause of divorce and family dysfunction is unhealed emotional wounds, the soul wounds. Of course, there are also effects in the finances. The state of your soul directly affects, your financial level. Okay, when the soul is not attended to, when it is wounded, it may lead to erratic decisions being made. And with business, you don't want to go that direction. Then, of course, there's also this lack of initiative when you are in a low mode. So you end up not really coming up with a bright ideas that would spur your business to higher levels. So there are many effects of these soul wounds. We cannot cover it all in this short time. But this is just a tip of the iceberg for you to realize that there is an issue that has to be sorted, and we are the ones responsible for sorting out that. And so at Living a Full Life Forum, that is our desire to see you healthy in body, in soul, and in spirit. Okay. So sometimes I look back and I wonder how I got into this. Possibly it's because of my upbringing, how I grew up and the struggles I've had in life. And that is why I end up having so much passion, for the health of the soul. You see, I grew up, in a what I could call a dysfunctional family, really. Yes, in a polygamous family. You see, in Africa, and especially for me who is from the royal lineage, polygamy is acceptable. It's culturally acceptable. It's a way to go. My grandparents, great-grandparents were kings, so they had many wives. And so my father somehow fell into the same line. So you find that it is acceptable. However, that doesn't protect you from developing these wounds, that come with a strife around, polygamous families. I am very much aware that part of my audience may have, maybe from religious background that are, inclined, to polygamy, and it's really acceptable. I do understand. However, one thing I know, most of us from those families, we suffer from similar issues. So I had a lot of anger issues. I had, deep, rejection and low self-esteem, seeing my mother as the first wife in the home, and then there are all these other women, along the way, and the pain of growing up, in that state and thinking that, oh, maybe the other family, they're eating better than we are, they're buying them more clothes. So that kind of insecurity. So it gets embedded in you early, and somehow you don't know it. So for me, I put on a show. So I had my defense lines, we always have coping mechanisms. So I always say that no one will ever do to me what I saw happening in my home. And so I had this, extreme, desire to perform and to prove a point. And so I had what we could call the performance-based confidence. So I always worked extra hard to win approval or to prove that, everything, was really okay. And yet deep inside, I was dying. And so whenever a situation would come that would irritate me, I would blow up out of proportion in anger. And that really affected my family life, my marriage, and all that. And so with time, I realized I could not move on like that. So I had to step back and start looking through my life and going through help. I had to seek help, so that I could come out of the anger and out of all these, the high walls I had put, around myself to guard myself from pain. You see, in life, it is good to reach a point where you are vulnerable to some degree. You can't always be guarding and thinking you'll be in control of everything. And so when I started coming out, I realized what a beautiful life it is to be free from all these confines of emotional wounds. And so I know I'm work in progress, but I've moved a long distance. I know what it means to be in the bondage of soul wounds, and I also know what it means to experience degrees of liberty, freedom, where you are not controlled, by your emotions. And that is why I go out and I want people to come out of, those prisons and those soul wounds. Because you see, when you have bitterness in your heart, when you have a lot of strife, just know it oozes out. There's an aura of negativity around you. And so because you are hurt, then you hurt other people, and you may never know it. So the moment it is not attended to, you know that there are many other people who will not like to be around you. And so it will spoil your opportunities of work, of relationships, of friendships. And you don't want to live that kind of life. So you must be ready to face your troubles, face your pain, and come out of it. Come out of all the soul wounds so that you live the full life that your Creator made you to be. Okay, so you are able to come out of those wounds and all that, and then you will have a better life, not only at soul level, but also your physical, your social life, and of course your financial life. And so that is what we are for at Living a Full Life Forum. Please be on the lookout. We will have more and more episodes, and you will not regret it. So the next episode we are having will be in the next few days, and it's a topic that is fundamental, that is like a foundation of living a full life, and that is being uniquely you. And you're going to see that the best gifts you can offer the world is the best you, not a photocopy of something else. And of course, by the end of the session, you will just develop so much love for yourself and the desire to see you becoming better and better. And so thank you so much for your time. I'm so happy you have joined. Please subscribe, please share the link, and be part of us. Be on the lookout. In the next few days, we will be putting up another video, and you will not regret this journey. Please do walk the journey with us as we walk your journey with you. Blessings. I love you all.